aspects of what's going on concerning the coronavirus. We appreciate everything that Secretary Perdue is doing at the leadership of President Trump, knowing that even though our farmers and ranchers too are suffering right now, the response by the President will provide some level of relief. Now, the President also talked about and got a lot of questions about something that he has been talking about over the past week or so, and that is economic revitalization. As I've mentioned before, I and my team have been involved in multiple levels of contact with the President, with the Vice President, with Secretary Mnuchin, with the entire economic team about what next steps will be across the country and what next steps will be in states as it concerns economic revitalization. Well, we will be learning in more detail in the coming week what the approaches will be by the White House for the United States of America, both with regard to economic revitalization, but also doing so in ways that maintain public health and safety. And then also connected to that, next week I will be providing an executive order talking about what will be done in Texas about reopening Texas businesses also in a way that will be safe for that economic revitalization. We will focus on protecting lives while restoring livelihoods. We can and we must do this. We can do both. Expand and restore the livelihoods that Texans want to have by helping them return to work. You know, one thing about Texans, they so much enjoy working, and I know they want to get back into the workforce. But we have to articulate also the strategies about ways we can do this safely, and that's one thing we will be doing next week. Now on to the numbers. So as of earlier today, the total number of Texans who have been tested for COVID-19 is now up to about 116,000 Texans. We continue this trajectory where we are increasing the amount of testing by a daily compounded rate of 10%. The number of Texans who have tested positive is 11,449, still maintaining that statistic of a little bit less than 10% of the Texans who were tested test positive. We also have confirmed hospitalizations of 1,532 Texans who are hospitalized in part because of COVID-19. Unfortunately, we now have a total of 221 Texans who've lost their lives because of COVID-19. That's a number that, if you were to compare it to other states, it would look like a relatively small number. But if you compare it to the hearts and souls of the households who've lost a member, it's a number that's far too large. The key thing that we focus on every day here is strategies to make sure we can minimize the loss of life. And because of our healthcare professionals and the terrific job they've been doing, they have done an excellent job of minimizing the loss of life. That said, we know every life lost is one too many. Now, there is another statistic that we have begun to track and that we will be sharing with you on a daily basis, and that is the number of people who have been categorized as recovered. What that means is these are Texans who have tested positive for COVID-19, and they've gone through the process of recovering from that infection. And before they can be categorized as recovered, they have to go through at least a 14-day period of being free from COVID-19. That's why you will see that there's a lag time period in providing you the recovery rates because of the time period after they test positive for COVID-19. I'm proud to say that in Texas we have 1,366 Texans who have recovered from COVID-19. But get this, of all these other states in the United States that have far more infectious rate and far more people who have tested positive for COVID-19, Texas ranks second most in the United States of America for the most people who have recovered from COVID-19. We continue to see hospital bed capacity to be very strong. We, as of today, still have more than 20,000, actually 20,488 beds that are available statewide, and 2,248 ICU beds that are available. We have 7,834 ventilators that are available. And I got to tell you, this past week has been a remarkable week for what has been done in expanding and delivering the amount of PPE, the personal protection equipment, that our first responders and our medical care professionals so desperately need. In just the past 8 days, we have shipped out 3,710,000 masks, 116,700 face shields, 4,480,000 gloves, and 78,000 gowns and coveralls. Now, one thing that we want to do today is to show you a little bit more graphically about what the spread of the coronavirus looks like both statewide, but also in the largest metropolitan areas. So this time I'm going to turn around and face this screen and describe to you a little bit of what we're seeing. So in this first screen, this is the statewide information. I'm going to show you four very important lines. The top line is a blue line, and that is the total number of cases in the state of Texas that's done in a way that is added to every single day. My point is this, and that is, as you see that blue line, the way that it's measured is it's never going to go down because you're adding to it every single day. So when we talk about bending the curve, we'll talk about that momentarily. Just know that that top line, because it will continue to aggregate more and more cases every day, it will never turn. But the key thing to look at on that blue line is, what is the degree of the angle? Is it more facing up, or is it more laying down? The degree of that angle shows you the extent to which we are slowing the spread. As you can see early on in the latter part of March, the angle was going almost vertically straight up. As you can see now, the angle is laying down more. That means that we are beginning to slow the growth of the coronavirus. We've not yet reached the peak and begun on the decline yet. The red line that you see in the middle, that red line shows the total number of new positive cases on a daily basis. Obviously, it's jagged, and obviously you can see that as we began testing in the latter part of March, there was a dramatic jump, and then it has begun to level off a little bit. But you can still see there is a slight upward slope in the red line, showing that we still have an increase in the number of people who are being tested positive, and we have not yet begun to go on the downslope side of that curve. On this graph, it will not show up on the local graphs I'm going to go over later. On this graph, you'll see a green, you might want to call it teal color line. It's right above that red line. It may be hard to see, but it may be the most important line on here as far as I'm concerned. That green color line, it begins about April the 1st, and it's the number of hospitalizations. If you look at that green line, you will see several times when it goes up in number. You will also see what I think is most important, and that is on the right-hand side of that green line, you see that it's relatively flat. So for several days now, in the entire state of Texas, the total number of Texans hospitalized has remained relatively flat, despite the fact that we have mortality numbers always lag a week or two behind the total numbers that come in for those who test positive. And so we will see a peaking and then a downsloping of the total number of people testing positive before we will see a peaking and a downturn in the total people who lose their lives because of COVID-19 if our graphs are consistent with most of the other graphs that we see. Next slide. So what we wanted to do for you is to provide you information from around the state of Texas, from all of the large counties, sharing everything that I just talked about except for the hospitalization rate. And these are all just in alphabetical order. So you see Bexar County, and understand, look on the blue line, again, the blue line are the total number of new positive cases of COVID-19. On the left side, going up all the way to the latter part of March, you see a sharp incline. Now you're beginning to see the slope of that line begin to level off a little bit. That shows that the growth rate is far smaller than it was in the past. And you see the results of that in the red line. And so the most recent number we have for people testing positive on a daily basis is 51, that's shown on the right-hand side on the red line. That clearly is below the high water mark for those testing positive in San Antonio, which was 88. Hopefully that 88 that looked like it occurred in the early days of April will be the high water mark for Bexar County. If that is true, and if the red line continues to stay below 88 and maybe doesn't go much above where it is right now, 51, that means that Bexar County truly will be past the peak on a downward trend with regard to the number of people testing positive. I hasten to say it's too early to declare that right now. It is good, however, that we've had 5 days now of testing far below the 88, which seemed to be the peak in the Bexar County area. You see also a period of time without any deaths, and then the death rate increase a little bit, and that again will continue to increase a little bit. Hopefully it will begin to slope down real soon. Next slide. So this is Collin County, and if you go back one and come back, so you look on the second half of the blue curve in Bexar County. Now let's go forward to Collin County. So in Collin County, you see the slope of the blue line is actually, where it is right now, is a little bit steeper than it was in Bexar County. That would mean that the growth of the number of cases in Collin County has not slowed as much as it has in Bexar County. It has slowed because the slope of the blue line is not as steep as it was early on, but it's not slowed as much as it has in Bexar County. And you can kind of see that. The good news is if you look at all the high marks in Collin County, going back almost to March the 26th to April the 10th. So in March 26th, there were 35 people tested positive. As of April the 10th, there were 35 people that tested positive that day. And there are a bunch of numbers in between with only one at a higher rate, two at a higher rate. You got 43 and 37. So Collin County has been fairly consistent. And the high level marks people testing positive, they may be getting close to being able to bend their curve. Next slide. Now this is a good chart to look at because this is Dallas County. And you can see once again, like so many of the other counties, there's a period when there's a sharp increase. If you look at the degree of the angle of the blue line, you'll see that Dallas County really is leveling off more than the other counties that we've talked about before. And you can kind of, again, see that in the numbers. The most recent number in Dallas County of the people testing positive to the far right in the red line is 63, which is far below the early 134, and then the multiple days around 100 to 190, 94, 97, and then there was a spike up to 106. But there's a couple of good days where they've been at 43 and 63. Again, it's too early to say that Dallas has peaked. It is fair to say that things are looking like they are beginning to level off a little bit. Next slide. Denton County, also same thing, an extremely steep curve almost through the end of March. And then clearly, if you look at the slope of that curve, it's changed dramatically. I talked to County, and you know, we talked about, if you can recall, there was this state-supported living center in Denton County where there was a very large number of people who had to be tested, and that led to a steep rise early on. Fortunately, they were able to very swiftly contain that situation. It did not turn into the dire situation that we were concerned it could turn into, and we appreciate the local level swift response in handling this in a very effective way. And because of the way that Denton County has responded, that has led to a decrease in the angle of the slope, and hopefully they're getting close to leveling off. Again, if you look at these numbers, after the high water mark of 54 testing positive one day, they've been consistently around between 26 and 32 almost every single day. Again, the 32 is higher than it was a couple of days ago at 15 and 16, so we can't say for sure that they have bent the slope going down, but it should be coming here in about a week or so, hopefully. Next slide. So El Paso shows you a completely different type of blue line. The other lines we've been looking at shows the angle of the line flattening off a little bit. In El Paso, you see the angle of the line continuing up. So I talked to DeMargo, the mayor of El Paso, to visit with him about what was going on, as well as offering any type of support Texas would, that they would need from the state of Texas. Understand a couple of things. The total number, which I don't have, if I recall, it's around 200, a little bit over 200. Did you recall off the top of your head? Put it this way, the total number of people in El Paso County is far lower than the total number of people in these other counties we've been talking about. As a result, that's one thing that enhances the slope a little bit. But also in talking to the mayor, they feel like they haven't with emphasizing, but especially at a time when Paso would want to go and be with her. Just know that clearly looking at the trend line in large numbers, you really are compromising the health and safety and maybe the lives of members. Most recent number, 39, of the most recent. So that shows clearly right now. But again, we will be doing everything we is the county that has the most people who have tested positive, and their numbers continue to go up. Some good news is this is not quite at the same angle as Dallas County, but it's clear to see that all the way through the latter part of March, there was a pretty steep angle, and then the angle begins to level off a little bit. You can see with the red line that it goes up and down, but the trend line still is an upward trend line. So Harris County is not quite at the same level as Dallas County and Bexar County and some other counties with regard to, let's say, a flattening of the number of new cases. It is good that the two most recent days are far below the 414 that was 2 days ago, but we still have a lot more information to gather before we can start making any positive predictions about Harris County. What I can tell you is this, and that is, over the past several days, I have visited both with the Vice President multiple times, as well as Lena Hidalgo and her team. Lena Hidalgo is the county judge in Harris County. So I visited with her and her team on multiple occasions to talk about several things. One is to talk about the facility that's being set up at NRG Arena to make sure that they will have overflow capacity if needed, if they have an overflow of a number of COVID-19 patients. And they set up this facility working alongside with the U.S. Army Corps of Engineers, as well as FEMA, as well as the National Guard here in Texas. So they're prepared medically to be able to deal with the challenges. Also, I worked to make sure that Harris County would be receiving more testing capabilities as well as some other strategies to make sure that we are assisting them in reducing the growth that we're seeing in Harris County. Next slide. So Lubbock County, a couple of things about it. One is if you look at the angle of the top line, the blue line, which is the total number of people added on top of each other every single day who are testing positive, that angle is a steeper angle than some of these other counties. That said, if you look at the red line, since the latter part of March, the top number in the red line has stayed fairly consistent. You have 26, 23, 21, 26, 23. And so the good news is they haven't had any meaningful spikes above what their consistent top line number is. So that means there is some level of containment. Obviously, we want to see those numbers on the red line go down, and that will show that Lubbock has gained control of the situation and should be moving toward a point of containment. Next slide. Tarrant County is in a way kind of the same as Lubbock County, although the numbers are larger. You see early on a steep slope and then an angle that's far better than the early steep slope. But the angle of the blue line is not adequately bending to show that they are where we want them to be. That said, kind of like with Lubbock, the top line numbers of the number of people testing positive is remaining contained compared to the high point of 98 that looks like it took place on March 31st. Since then, you have high marks of 58, 65, and 71. If over the week it shows that it doesn't go above 71 again and they start going down, that will show that Tarrant County will have their situation under control. Next slide. Travis County shows the type of line that you want to see. Again, early on, kind of a steep angle, but look from, it looks like about March the 24th, when they had 57 people on the red line, 57 people tested positive that day. From that day on, look at the slope of the blue line. The slope begins to be at a lower degree angle, which means things are leveling off. And you kind of see that with regard to the red line numbers. They did come down in the latter days of March and then spike back up to 61 and 79 in the early days of April. But since then, their high water mark is 52 and now 43. Again, it's way too early to make any great pronouncements that Travis County is on the downslope. But since about April the 2nd, it looks like their numbers of people testing positive is definitely going in the right direction. Next slide. So Webb County looks kind of like El Paso in that the angle of the blue line continues to go upward at a degree that shows more concern about Webb County. Again, the raw number of people testing positive is not as high as it is in the larger counties, but it's still too high. You can see the red line continue an upward trend, although the last pretty much almost a month of on the number of people tested positive to be no more than around 20, it will show that they will begin to gain control of it, and that blue line will begin to flatten off at a slower degree. But it is an area that we will be watching carefully, and again, we'll be doing whatever we can to assist them in Webb County. Next slide. So this is important right here. This is exactly what Dr. Zerwas was talking about at our last conference when he talked about doubling time. So, in fact, Doctor, you'll do a better job of describing this than myself.
What we're looking at here is the period of time that it takes to actually double the number of identified cases. And so if you look way back in something like Italy early on, that doubling time was 1 to 1.5 days, incredibly fast rate of increase in new cases. And so it's pretty common in the epidemiological circles to look at doubling time. Our time started out when we first started really addressing this around 3 days. So we started out certainly in a better place than New York or Italy started out. But we've continued through the measures that the governor has put in place, seen that time increase significantly over the past month. And so to go to this level over a period of a couple, 3 weeks' time is really evident that the efforts towards distancing ourselves, staying out of high-density congregated areas and so forth, good hygiene, all things that the governor and Dr. Hellerstedt like to talk about, they really do have a profound impact. And if there's something that shows that really better than anything, I think it's in fact the doubling time that you see here.
Thank you. And so one thing that I know people want, they want to see signs of hope, signs of success. This is a mathematical sign of success. That line going down is so important. That line going down means that we're slowing the pace at which COVID-19 is growing in the state of Texas. We want to see that line continue to go down in the coming weeks, which will be a further signal that we have bent the curve. Next slide. That's it. Very good. So picking back up with some things that I talked about and expanding on it a tiny bit. As I mentioned, I spoke with Vice President Pence for the second time this past week. And I mentioned about Harris County, but more broadly, we talked about the state of Texas, and they remain concerned about the state of Texas. They want to make sure that they in the White House and nationally, they're doing everything they can to assist Texas in its ongoing fight against the coronavirus. And so we talked about the strategic use of more federal resources where needed to make sure that we will have the capability of responding, whether it be with regard to testing or other types of strategies. And I want the Vice President to know how much Texas appreciates what he and the President are doing to help the state of Texas. Additionally, however, I want to point out that even though the federal government is providing more resources for things like testing, a lot of the testing equipment, supplies, et cetera, really are being provided by the private sector. When the early response to the coronavirus began, almost all of the testing capability was coming from the federal government. In the aftermath of the early response, we saw a very prolific increase of the capabilities of the private sector to both produce the testing equipment and to disseminate the testing, whereas initially it was public health authorities. Now public health authorities continue to provide testing. FEMA continues to provide testing. But most of the testing that's taking place is done by the private sector, whether it be private healthcare providers, these drive-through facilities that you see seemingly to increase across the state of Texas on a daily basis. And it will be these private providers that will help Texas continue our increasing in testing across. I mentioned with regard to Harris County, but now I want to expand what is going on with regard to the collaborative efforts of the Texas National Guard, working under the leadership of General Tracy Norris, as well as working in collaboration with the U.S. Army Corps of Engineers. They continue to identify and set up additional healthcare facilities and testing sites across Texas. One location they're working with right now is the area of Beaumont. And earlier today, I got off the phone with the county judge in Jefferson County, and we talked about what was going on in the area, and they were a little concerned about hospital capacity, and they wanted to make sure that they would have available to them all healthcare capabilities in the event that they continue to have more and more people test positive. And so we talked about ensuring that Texas would collaborate with Jefferson County and the multi-county region in that area of Texas to make sure they have everything they need, including, I emphasized to them, that Texas has plenty of ventilators. If they need any ventilators whatsoever, know that their every need will be quickly met. And with regard to the National Guard, as we speak today, there are 1,058 National Guard who have been deployed across the state of Texas to help in the response to COVID-19. Well, to address a very meaningful concern that we have, as I mentioned earlier, we have these doctors, these nurses, these healthcare providers. We have law enforcement officers. We have other first responders that They have to be on the front lines every single day to help us respond to the coronavirus. An issue they have to deal with as they go to the front lines. For those who have children, what happens to their child during the course of the day? What happens with their child care needs? To better address that and to assist all of our essential workers, today we have launched an online frontline child care portal. This is a project of the Texas Frontline Child Care Task Force led by Elaine Mendoza. Elaine Mendoza is the chair of the Board of Regents for Texas A&M University. And she is working with the Texas Workforce Commission, the Texas Health and Human Services Commission, the Texas Agency, Texas Higher Education Coordinating Board. Critical services that we need to operate our state and to help people remain safe. So, some numbers. Overnight, about 1,000 child care spots were filled. Currently, there remain 88,450 slots that are open, 13,027 infant spots, 22,281 toddler spots, 28,184 pre-K spots, and 24,954 school-age. You're able to what your fellow Texans desperately need on the front line. Now, there's an agency in the state of Texas that is particular, and that is smashing record number of people who filed for unemployment benefits. So much so that in order to respond to it, the Texas Workforce Commission has added hundreds upon hundreds of additional employees and now have staff members from both the Texas House of Representatives as well as the Texas Senate aiding in the response. And they're now working 7 days a week. Well, been paid. Already 363,335 claims paid. Will be larger in amount and for a longer period of time because of the extra money provided by Congress and the President. Now, I continue to go about the process of suspending certain laws where needed to help Texans respond and deal with the challenges of the coronavirus. One that I did since we last met was an executive order to allow for the appearance before a notary
President Trump has backed off his original Easter Sunday date to reopen parts of the U.S. economy, but heading into the Holy Weekend, he's still pushing an optimistic timeline.
We're looking at a date. We hope we're going to be able to fulfill a certain date, but we're not doing anything until we know that this country is going to be healthy.
On Fox News, one of the president's top health experts echoing some of his optimism.
Some places will be able to think about opening on May 1st. Most of the country will not.
But not all.
My message is that the virus itself is going to determine the guideline.
New York's governor echoing that.
The key to reopening is going to be testing. I've said that from day one. It's not going to be a light